All right, so are you ready to dive deep into some cutting-edge research on severe pneumonia?
Always. Let's do it.
Okay, so we've got a stack of papers here, hot off the press, and they really dig into some fascinating aspects of this illness.
Yeah, pneumonia is one of those things that's been around forever, and you'd think we'd have it all figured out by now, right?
Right. But it's still a major challenge, especially those severe cases.
Absolutely.
So we're going to unpack all of that, the diagnostic dilemmas, the surprising role of lung bacteria.
Oh, yeah, that was news to me.
Yeah, I know, right? We'll get to that. And even a little bit about how AI might be the future of spotting this tricky illness.
It's like trying to solve a mystery, but inside the human body.
Exactly. Okay, so before we get too far ahead, I think it's important to clarify what we're actually talking about when we say pneumonia. We're specifically focusing on two main types, right?
Right. We've got severe community-acquired pneumonia.
Or SKP, as the cool kids call it.
Yeah, SKAP. And then there's hospital-acquired pneumonia, better known as HAP.
And this distinction matters, right? Because we're talking about different environments, different bacteria.
Absolutely. The bugs you might encounter out in the community are going to be different from the ones lurking around a hospital. And knowing that difference is key for deciding on the right treatment.
Okay, so two different battlefields, two different sets of enemies. So we've got SKP and HAP. Now, one of the things that really jumped out at me from these papers is just how difficult it can be to accurately diagnose pneumonia, particularly in severe cases.
Yeah, it really is. One paper even compared it to hitting a moving target in a thick fog.
Ooh, that's a tough one.
It's true, though. And it all comes down to the fact that those classic symptoms, fever,
Makes
cough.
me feel crummy.
Yeah, exactly. Those symptoms are so generic. They could point to a million different things, especially if someone's immune system is already compromised.
Yeah, one paper actually said it's about as useful as a sale sign in January.
Right, you see it everywhere.
Yeah.
So clearly, symptoms alone aren't enough. So then the question is, what about all those high-tech imaging tests? X-rays, CT scans, .eeg. Those seem like the obvious solution.
You'd think so, right? But it turns out it's not that simple.
Nope, not at all. One study actually showed that chest X-rays, which are often the go-to initial test, only correctly identified pneumonia about 26% of the time.
26%, that's like flipping a coin.
Pretty much, yeah. And while CT scans give you a much clearer picture, they're not always practical, especially for someone who's critically ill in the ICU.
Right, you can't exactly wheel someone who's hooked up to a dozen machines down the hall for a scan every time you need more information.
Exactly. Plus, there's the radiation exposure to consider, too.
So, if symptoms are unreliable and imaging has its limitations, where do we go from here? Well, that's where things get really interesting. One avenue researchers are exploring is the role of the lung microbiome in pneumonia.
Okay, yeah, the microbiome.
Now, I have to admit, when I first heard about this, I was like, wait, our lungs aren't sterile. I always thought they were like this fortress, fiercely guarded from any outside invaders.
Right, me too.
No.
But it turns out our lungs are more like a bustling city, teeming with all sorts of bacteria.
So not an invasion, but like a delicate ecosystem.
Exactly. And when that balance gets disrupted, which can happen for a bunch of reasons, that's when things can go haywire. Illness, certain medications, even just the stress of being in the ICU, all of that can throw the microbiome out of whack.
And that imbalance, that's what's known as dysbiosis, right?
Exactly. It's basically when the wrong bacteria take over. And that can make pneumonia much, much harder to treat.
So understanding how this lung microbiome gets disrupted, it's critical for both diagnosis and treatment, isn't it?
Absolutely. It's like a whole new frontier in medicine.
So if our lungs are like this bustling city, are we talking about like identifying which bad guys are causing the trouble? Is that how understanding this microbiome helps us diagnose pneumonia?
You're right on the money. Some of the research suggests that these microbial shifts, the changes in our lung bacteria, could actually act as an early warning system for pneumonia.
Whoa, so it's like a crystal ball, but for pneumonia, seeing it coming before it even really hits.
That's the hope. But we still have a ways to go. We need to pinpoint exactly which bacteria are the troublemakers and how their presence changes during an infection.
Okay, so it's like gathering intel before a big operation. Speaking of intel, what about those rapid tests that can identify bacteria in just a few hours? I've heard those are pretty promising.
You're talking about molecular diagnostics like PCR.
Right, PCR.
Yeah, imagine being able to identify the culprit bacteria and its weaknesses within like a matter of hours. That would allow for much more targeted treatment.
That sounds incredibly efficient, but I sense a but coming.
You know me too well. While incredibly promising, these tests sometimes pick up on harmless bacteria that are just going about their business in the lungs.
So they're a little overzealous.
In a way, yes, and that can lead to overtreatment with antibiotics, which we know is a whole other issue.
Right. Too much of a good thing and all that. Are there other downsides?
Well, currently they are pretty expensive and not universally available. You're more likely to find them in a research setting than your local clinic.
Makes sense. So still some hurdles to overcome, but it sounds like the potential is huge.
Absolutely. As the technology becomes more refined and more accessible, it could really revolutionize how we approach pneumonia diagnosis.
It's like we're on the edge of a whole new era in pneumonia care. Okay, so we've talked about imaging, we've talked about these rapid bacterial tests, but what about running some blood tests? Is there something in the blood that we can analyze to definitively diagnose pneumonia?
Ah, that's $1 million question, isn't it?
Yeah.
There are a few blood biomarkers, like procalcitonin and C-reactive protein, that show some promise.
Okay, I've heard of those. They're indicators of inflammation in the body, right?
Exactly. But the thing is, while elevated levels can be a clue, they can also be influenced by other factors besides pneumonia, other infections, chronic inflammatory conditions, things like that.
So not a perfect system.
Not quite. More like another piece of the puzzle.
Right, right. So it really is like trying to solve a puzzle. Your age, your medical history, the specific bacteria causing the problem, the state of your lung microbiome. It seems like every piece matters.
You're exactly right. And that's what makes diagnosing pneumonia so tricky. There's no one-size-fits-all answer. Each case is unique.
And speaking of unique challenges, one of these papers really delved into the surprisingly tricky question of defining when pneumonia is actually cured.
It's true. There's no universally agreed-upon definition of what clinical cure for pneumonia actually looks like.
So how do doctors determine if a treatment is working and when it's safe to stop antibiotics?
Well, that's the million-dollar question, and unfortunately, there isn't a simple answer. Without that clear endpoint, it's easy to overprescribe antibiotics, which, as we've touched on, can have a ripple effect on the lung microbiome and contribute to antibiotic resistance.
So it's a delicate balance for sure. So where do we go from here? How do we get better at diagnosing and treating pneumonia in a way that addresses all of this complexity?
Well, this is where things get really futuristic. One of the papers suggests that artificial intelligence, AI, could hold the key to more accurate and efficient pneumonia diagnosis.
AI. Okay, now this I have to hear more about.
Imagine a system that can analyze tons of patient data, medical history, vital signs, lab results, imaging, and pinpoint those at high risk of developing pneumonia, even before they show any symptoms.
It's like a pre-crime unit, but for pneumonia.
In a way, yes. And early studies are showing that AI can identify these subtle patterns in data that humans might miss, potentially allowing for earlier and more effective intervention.
This is incredible. This is all very new, right? Are we ready to hand over the diagnostic reins to AI?
It's certainly exciting, but it's still early days. Most of these studies are retrospective, meaning they're looking back at data that's already been collected.
So the next step is to see how it performs in real time in the unpredictable world of actual patients.
Exactly. We need those robust clinical trials to really put AI to the test and see if it can truly live up to the hype and improve patient outcomes. But the possibilities are incredibly exciting.
It feels like we're on the verge of a massive shift in how we understand and treat pneumonia. We're moving from a one-size-fits-all approach to something far more personalized, aren't we?
Absolutely. The future of pneumonia care is about understanding not just the disease, but the individual patient.
It's about recognizing that each person's experience with pneumonia is shaped by this complex interplay of factors: their age, their health history, their lifestyle, and of course, the unique ecosystem of their lung microbiome. It's about tailoring treatments based on all of these individual pieces of the puzzle.
You've summed it up perfectly.
Yeah.
And that's what makes this research so compelling. It's not just about finding a cure for pneumonia. It's about finding the right cure for you.
You know, as we've been going through all of this research, all these diagnostic tools and potential breakthroughs, it really drives home the point that we're moving towards this idea of personalized medicine, aren't we? It's not just about identifying pneumonia, but about understanding your specific situation, your individual risk factors, and tailoring treatment accordingly.
Absolutely. And that's a recurring theme throughout all of these research papers. For instance, one paper dives into this ongoing debate about using broad-spectrum antibiotics versus those with a narrower focus.
Right, because it's not always a one-size-fits-all approach, right?
Exactly. It's like choosing the right tool from a toolbox. You wouldn't use a sledgehammer to hang a picture.
I like that analogy. So how do doctors decide which route to take, which tool to use in this case?
Well, the research really highlights the potential of risk assessment models. And yeah, even AI comes into play here.
AI helping to choose the right antibiotic.
Imagine a system that can analyze your medical history, your current symptoms, even the presence of specific bacteria, and then recommend the most effective antibiotic approach.
Wow, so less guesswork, more precision medicine. Are there any specific examples of these models in action?
Absolutely. One that's mentioned is the PES score, which stands for Pneumonia Severity Index.
Hmm.
It takes into account things like your age, previous antibiotic use, and even whether you have chills.
Chills, really?
Yep. All those factors play a role. And based on that information, it helps determine the likelihood of you needing those stronger, broader spectrum antibiotics.
So it's bringing more data, more precision to that decision-making process, which is crucial because we want to make sure those broader spectrum antibiotics are used only when absolutely necessary.
Exactly. It's about being strategic, minimizing collateral damage. And speaking of collateral damage, another really interesting area of research focuses on the potential benefits of certain medications beyond just their ability to fight bacteria.
Oh, tell me more.
Well, one class of antibiotics that caught my eye is macrolides. Now, you might be thinking, wait, haven't we already covered antibiotics? But here's where it gets really cool. Macrolides, in addition to their antibacterial action, also appear to have anti-inflammatory effects.
So it's like they're pulling double duty, fighting the infection and calming down the body's inflammatory response.
Exactly. You see, sometimes the body's own immune response can actually cause more harm than the infection itself. It's like your defenses are working overtime, causing unnecessary damage. And macrolides seem to help modulate that response, reducing inflammation, potentially improving outcomes.
That's fascinating. So are macrolides being used differently now because of these potential additional benefits?
Researchers are definitely taking notice. Some studies have even suggested that in cases of severe pneumonia, macrolides might actually be more effective than other commonly used antibiotics, like quinolones, in reducing both mortality rates and the need for mechanical ventilation.
Wow, that's pretty significant.
Mm,
But I imagine, as with all things in medicine, more research is needed to confirm these findings.
absolutely. We need those larger clinical trials to really solidify these early promising results. But it's this kind of research that really pushes the boundaries of our understanding and leads to more effective, more personalized treatment approaches.
It's been incredible to dive deep into this research with you today. So as we wrap up, what's the key takeaway you hope our listeners are left with?
At the end of the day, when it comes to severe pneumonia, it's not a one-size-fits-all approach. It's about recognizing the complexity of the disease, understanding your individual circumstances, and staying informed about the incredible advancements happening in diagnostics and treatment.
It's about moving towards a future where pneumonia care is truly personalized, truly tailored to you.
Exactly.
And that is definitely something worth diving deep for.